Thanks, Tyler. Well, May is Mental Health Awareness Month, and here to help us identify the warning signs of depression and suicidal thoughts is Nurse Christina Paris from the VA. So good morning, Nurse Christina, and thank you so much for being with us this morning.
Hi, good morning.
Good morning to you. This is a very important topic here. So let's start with depression. So what exactly is it, and how does somebody know if they are depressed?
So depression is a disorder that can make you kind of sad or just feel different in an unnormal sadness. And if you have, it can also affect your work. It can affect your work, your being able to study, being able to just even do everyday tasks. And then you can know that you're depressed if you have one or two symptoms, like they're no longer enjoying things that they used to, they feel sad or down, maybe some changes in weight, they're sleeping a little too much, tired all the time, little energy, maybe they feel guilty or worthless, forgetting things, confused, move or speak slowly. Things like that can all be signs of depression.
Yeah, they're very common signs too, I feel like, and it can really happen to anybody. So what are some of the treatments that people can get for depression?
So the easiest treatment is medication. You can go and talk to your provider, primary care provider. You can seek counseling, or there's even different kinds of like massage therapy and electrical therapy and things like that can be used for more significant and severe depression.
Gotcha. And another important topic that isn't talked about as much that should be talked about, especially during this month, is suicide. So how can we help someone who may be engaging in suicidal behaviors?
So if you think that they are engaging in different behaviors, you want to call your doctor right away. You want to get them to the urgent care or the ER. You want to call an ambulance. There's also the National Crisis Line that you can call to. And I stress to people that it's a crisis line. So if you're thinking of self-directed violence, maybe not necessarily suicide, but you're in crisis, do call them. That's what they're there for.
Gotcha. No, that's a lot of good tips there, and it's good to just kind of be sensitive and be there for that person that you may be worried about. Now, I know that you at the VA and other people that work there as well, you guys have all seen these signs before, but what exactly have the studies there been showing?
So it shows that 20 veterans have suicidal ideation or self-directed violent ideations or thoughts. And only 6 of those 20 people are even enrolled in our VA system, and only 3 of those 20 are actually seeking mental health. That means 17 out of 20 people really need the support of their family, friends, church, and their primary care providers. So we really have to be aware of what's going on with our loved ones and be ready to help.
Right. A lot of good advice there. Just be aware and be ready. So what should you do if you see someone that actually might hurt themselves?
Sure. So as I said before, you want to call the doctor. And I'm sure, because we're doing this via the phone, I didn't give you the warning signs, but I know you had that up on there. So you want to call your doctor. You want to be aware, be direct with people. You want to be willing to listen and judgmental and be available. All those things. Take action. So call. Help them get in touch with the crisis line or suicide prevention lines. There's lots of websites and things online that you can look up.
And I'm sure as people saw on their TVs right now that there are the numbers there and also the websites that you can go to if you do need more information. But Nurse Christina, thank you so much for breaking this down for us today and really explaining something that isn't talked about as much and is a really important subject.
Absolutely. Seek help. That's the key.
Absolutely. Thank you so much.